Purpose of this unit is to provide you with a basic understanding of the principles for providing high-quality drug addiction treatment. And we're going to discuss the settings in which treatment can occur and the relationship between different types of treatment. At the end of this lesson, you're going to be able to identify the key principles in providing high-quality drug addiction treatment, identify some of the goals of treatment, describe the settings where treatment occurs, and describe the relationship between different types of treatment. Before we discuss the basic principles in providing drug addiction treatment, we need to revisit this important consideration about drug addiction. Understanding that drug addiction is a medical condition affected by various external factors is going to help orient our discussion of the principles of treatment and the various settings where it's most effective. So clinical practice should follow these four common principles: the right care for the right person at the right time and in the right way. This may sound simple, but these are very important in order to ensure that treatment is effective. Determining the right care is going to require skill and commitment to make high-quality assessments and refer individuals to the full range of available services. Not just what services your organization provides, but a full range of services. So if your organization doesn't provide what the client needs, we need to refer them out. This means matching the service to the client's specific problem, while also taking into consideration their personal resources, and that's going to include the cognitive and their social resources, and while taking into consideration their current stage of change. High-quality services are going to adhere to effective, proven, and strategic models. So appropriate timing means ensuring that services are available when the individual is actually interested and prepared to commit to doing something about their substance use. And in considering all of these four elements, you're ensuring that the treatment program is catered to an individual's needs. Effective treatment also necessitates that treatment progress be monitored and reviewed regularly. So constantly checking in on the treatment plan with the client, making sure that they are meeting those needs. Identifying the right care involves understanding an individual's needs and their capabilities, and also matching the treatment to their stage of change. And in the right way implies that the clinical service is being provided in a way that's consistent with the stated philosophy, objectives, and techniques of that treatment program. And it can also mean that the individual counselor is using skills and techniques in a way that are intended to be used. So treating chronic diseases like diabetes and asthma and hypertension is going to involve the same principles that we apply in drug addiction treatment. And like patients with diabetes or heart disease, people in treatment for drug addiction often take medications as part of their treatment regimen. But they also need to learn skills and techniques for behavior change. So using medications and encouraging lifestyle changes through behavior change, treatment and counseling can be just as effective for drug users as it is for patients who have other chronic diseases. So combining medication and behavior change is the most effective approach, as opposed to using either in isolation with each other, just medication or just the counseling. So clinicians should also apply that same non-judgmental approach to treating drug users as they would in treating other chronic conditions like hypertension. So there's no single way to approach drug treatment. The treatment setting, the treatment model, the therapeutic focus and intensity is going to vary. So for example, the treatment setting may be residential, where somebody lives at the same place that they're receiving treatment, like a rehabilitation center. And it may also be an outpatient setting where the client comes in on a regular basis to receive treatment, or an inpatient setting where the client stays at a voluntary health facility. So the therapeutic model is going to vary depending on the theory and the technique that's utilized by the care provider. And counseling can be either cognitive or behavioral or both. So the therapeutic focus might include only the individual, or the individual in group therapy, or the individual with their family. And then the treatment intensity is also going to vary. It might be that the treatment is offered a certain number of days per week or a certain number of hours per day. It may be time limited or open-ended. And all of these factors are going to influence the suitability and the appropriateness of the treatment option. So let's begin with the key principles of effective treatment. There's no single treatment that's appropriate for all individuals. Clients love to have choices. Their goals, their problems, and their resources are all going to influence their treatment selection. So it's important that you get detailed information during your assessment and you're aware of available therapies that are in your area. So take the time to discuss these with your client and determine which treatment option they think is going to work best for them. So, for example, some clients may want to be treated with antagonist medications like naltrexone, while others might want to try traditional medicine or acupuncture, and others might consider methadone most acceptable for them. And effective treatment attends to the multiple needs of the individual, not just their drug use. Drug users usually are going to enter treatment with multiple problems. So treatment programs need to acknowledge this and try to address the different needs of the individual rather than just focusing on their drug use alone. So from a client perspective, their other needs are important to them and they need to be considered, especially in order for them to have trust and confidence in the treatment team. So having said that, the drug addiction treatment service may not provide all the services that are required to address the client's needs. So instead, the counselor may do it by linking and referring to other treatment services that specialize in those areas. The treatment needs to be readily available because barriers to access are going to deter a lot of people from seeking treatment. Delays in access to treatment significantly reduce the likelihood that clients are even going to enter treatment. And when they are ready to start, we should be ready to receive them. It shouldn't take weeks on end for them to get in to see someone. And I've seen some treatment programs it takes months to get in. And remaining in treatment for an adequate period of time is critical to the treatment effectiveness. The clients who remain in treatment for an adequate period of time generally have better treatment outcomes. And those who leave treatment early are much more likely to relapse or use drugs. At least 3 months in treatment is required for significant changes to occur. Some forms of treatment, like methadone, require a longer time for those changes to be maintained. So treatment progress and drug use while in treatment should be monitored. And sometimes this progress is slow, and other times it's really fast. It's critical that progress in drug use in the treatment is monitored to determine whether the treatment is helping and whether any alterations to treatment are required. I've had some people go into outpatient, and at that point they needed to go into an inpatient treatment facility or a detox facility because outpatient just wasn't working for them. We also need to think about the treatment plans. The treatment plans need to be assessed and modified continuously. You can't just make one and hope for the best. You make the first one about what you initially want to do, and then you go back and you revise the treatment plan. Regular review and update of goals and progress are important to modify the treatment plan as necessary. Sometimes this may be done once a month. Sometimes this may be done every 6 months. Sometimes it's done every 3 months. It kind of depends on what the requirements and regulations are in your area or your certification board or accreditation facility. Medicines for treating addiction are important, but other components for effective treatment are also important. And counseling and other behavior components are critical. Medication without counseling is not as effective as a combination of the two. And similarly, counseling without medication is not as effective as a combination of the two. And in addition to counseling, effective programs also employ behavior change treatment components. And detox is only the first stage of treatment, and by itself, it does very little to change long-term drug use. Some patients may think that detox is all they need to do to stay abstinent, but it's important to emphasize that detox is only the first stage of treatment. Relapse prevention counseling is essential, and patients who don't have counseling after detox are at a very high risk of relapsing. It's estimated that over 95% of patients who undergo detox only will return to using drugs. So treatment programs should provide testing for HIV, hepatitis, TB, and other infectious diseases, and provide some help and means to modifying risk behaviors. High rates of hepatitis, TB, and HIV exist among injection drug users. In some settings like rehabilitation centers, the HIV rate might be as high as 70%, and TB 5%, and hepatitis C is up to 80%. Assessment and referral is going to be critical so that we can address and modify these risks and to provide appropriate treatment for the clients. And treatment of comorbid conditions should be integrated. Patients commonly have other physical and psychiatric conditions such as depression and anxiety, and these need to be recognized and treated. Recovery from addiction can be a really long-term process, and frequently it's going to require multiple episodes of treatment. It's unusual for a drug user to require a single episode of treatment alone to recover from addiction. We have to remember that drug addiction is a chronic, relapsing medical disorder, so repeated treatment episodes may be necessary. For most users, the ultimate goal of drug treatment is to achieve abstinence, but some users may wish only to reduce their drug use or improve their ability to function and minimize the medical or social complications of their drug use. And there's a range of possible treatment outcomes that include reduction in drug or alcohol use, increased personal and social functioning, and improved public health and safety. And this might include reduction in HIV and hepatitis C transmission and a reduction in drug-related criminality. So this diagram is important for understanding the client's addiction treatment options. You can see the treatment options are interconnected. So this slide is intentionally made as a build slide. Each component is added as you advance forward. So the first build is designed to show the connection between abstinence and substance use and to identify that people may give up their use without ever becoming addicted or seeking treatment. And I'm using heroin here specifically so we can see that this is typically how this works for heroin use. The second build shows the linkage between heroin use and addiction to identify that it is possible for a person to stop their addiction without the need for treatment. And then the next build shows the linkage between addiction and risk reduction measures. People may not be prepared to change their drug use behavior, but counselors still should provide risk reduction information, which is going to include overdose education and HIV risk reduction. Then the next build is going to show the linkage between addiction and detox. Detoxification is a process. It's not a treatment. So clients need to be linked to relapse prevention approaches in order to maintain their abstinence. It's important that the relapse prevention approaches are provided in a range of settings, either outpatient or inpatient, and provide drug-free counseling and medications like Narcan or naltrexone. And then the next build is going to show the relationship between addiction and substitution treatment. So the main substitution treatment is methadone or Suboxone maintenance treatment. And then the double-headed arrow between detox and substitution treatment is going to indicate that some people try detox unsuccessfully, and so they move into substitution treatment. And some others who have completed substitution treatment still need to detox to be drug-free. So there's an artificial division between relapse prevention and substitution treatment. And just so you know, substitution treatment ideally is going to involve co-administration of drug addiction counseling. So information about risk reduction, HIV prevention, and overdose needs to be provided to all the clients, whether or not they wish to enter treatment. And some clients are going to undergo detox before entering into a relapse prevention treatment, while others may end up in substitution treatment programs because they find detox too difficult to complete. Detoxification is going to require medication to reduce the severity of withdrawal symptoms, and it has to be administered at a comfortable pace. Otherwise, it's going to increase the risk of the client leaving the program and relapsing. Detox is usually undertaken in a inpatient residential setting, but it can occur in hospitals and community-based settings. Ambulatory withdrawal is uncommon. That's the provision of medication to manage withdrawal from alcohol, opioids, and benzodiazepines. And when I say uncommon, it's uncommon in other countries. So in the United States, we typically do this. And after the substitution treatment, clients still are going to have to detox from the methadone or the Suboxone, and relapse prevention aftercare is going to be critical at that point. So both substitution treatment and relapse prevention treatment have to be coupled with drug addiction counseling. Some relapse prevention treatments teach general life skills, while others are going to provide that psychosocial support. So in conclusion here, the goal of drug addiction treatment, the ultimate goal of all drug addiction treatment for those who wish to abstain, is to enable our clients to achieve lasting abstinence. And the immediate goals are to reduce the drug use, to improve the client's ability to function and minimize their health and the social complications of drug use. So some key principles in providing drug addiction treatment: we need to remember that no single treatment is appropriate for all individuals. Effective treatment attends to the multiple needs of the individual, not just their drug use. Treatment needs to be readily available, and remaining in treatment for an adequate period of time is going to be critical to treatment efficacy. Treatment progress and drug use while in treatment should be monitored. Treatment plans need to be assessed and modified continually. And medications are an important element, but not the only component of a comprehensive treatment program. Counseling and other behavioral components are critical when we're treating clients. And detox is only the first stage of treatment, and by itself, it does little to change long-term drug use. Our treatment program should provide testing for HIV, hepatitis, TB, and other infectious diseases, and provide assistance to help clients modify risk behaviors. Treatment of comorbid conditions should be integrated, and recovery from addiction can be a long-term process, and it's frequently going to require multiple episodes of treatment. If you have any questions or comments, please feel free to put them in the chat box below this video in the lesson.